The connection between vitamin D and health. Disclaimer: if you think you may have a medical emergency, call your doctor, go to the emergency department, or call 911. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it. Do not take any herbs or supplements without first speaking with your healthcare provider. Melanin is what gives our skin, hair, and eyes its color. Did you know that the degeneration of melanin in certain parts of the brain can cause Parkinson's disease? Similarly, the degeneration of melanin in the skin can cause vitiligo. Primarily, melanin can be thought of as a natural sunscreen which protects us against damaging UV rays from the sun. Melanin is also present in various organs and tissues such as the spleen, liver, heart, kidney, brain, eye, lung, connective tissues, and muscles. Melanin also has antioxidant, anti-inflammatory, and anti-cancer properties, and overall, it enhances the immune system. Those with more pigment, also known as melanin, typically have lower levels of vitamin D. There are two forms of melanin which exist. Eumelanin is a dark brown pigment typically found in the so-called African Americans, Hispanics, and Native Americans. Pheomelanin is a much lighter melanin typically seen in the so-called Caucasians. Those with lighter skin tones are deficient in eumelanin. Both melanins are produced via two different pathways. Lighter skin tones have more pheomelanin, however, it does not offer as much protection from free radicals and skin cancer. Many of us were told that the only role of melanin was to provide us our skin color. But is this true? Let's see what the experts have to say about melanin.
Now, melanin has the same kind of ring structures and so on, and it makes very complex structures, and not all melanins are the same. As we'll talk about in a minute. In fact, there's somebody even studying that and wondering whether energy is directly absorbed from the melanin in your skin and transformed into energy in your body. Okay? And they even think about could in the future, and they're developing this now, they're taking melanin and making batteries out of them that store energy from the sunlight directly. It might, in fact, become a future source of how we're going to generate energy. Now, let's get back with that little bit of physics background. Let's talk about melanin inside, chaga and melanin inside the body. So it absorbs thousands of times more electromagnetic radiation actually than chlorophyll does. And chlorophyll is what we need to make proteins and sugars, especially sugars in the body. It exists in many other tissues, as I mentioned. It's actually a very important molecule in any woman who's having a baby, because the fetus has all this melanin in it, as I'll show you. Okay? And it's thought to be, by some people, a master molecule that actually steers how the body communicates. For example, Frank Barr, a scientist, wrote a whole article, a whole issue of a journal called Medical Hypothesis, saying, you know, melanin is such a special molecule and it's found in the babies, it may have a major role in steering things in the body, in the whole regulatory system. Melanin's role in embryological organization, that's in the baby's organization, and tissue repair and tissue regeneration may be connected to the major role that it plays to balance the body, that's called homeostasis, in the autonomic, neuroendocrine, and immunological system. So in other words, melanin may play a much bigger role than just absorbing all this radiation, and when you get it into your body, it actually has a major effect on your immune system. Here's a picture of a baby at 35 days of pregnancy, and this is the eye of an embryo inside a mother. It's a very tiny little thing. Notice that the eye is pure melanin. That's an amazing picture, isn't it? To see all this melanin is inside, and when the embryo first forms, there is what's called the dark streak. It's all melanin. Okay, here's an example of a plant. It's an eggplant that has melanin in it and a genetically changed one that is no melanin in it. Notice the size of the two difference. I mean, this is an indirect indication that melanin, directly can transduce energy in the vegetable kingdom.
In antiquity, we were exposed to the sun much more than we are today. In the past, our melanin served as a means to protect us from long hours in the sun. Today, we spend little, if any, time in direct sunlight, which causes us to be deficient in vitamin D. Melanin has been and continues to be well studied by experts and is known as the master molecule. The Caucasian race generates the highest levels of vitamin D3. Why? Well, their skin primarily contains pheomelanin, which allows much more penetration of UV rays into their skin. This same benefit can also harm them and can lead to skin cancer. So-called African Americans generate the lowest levels of vitamin D in their skin due to their melanin and limited sun exposure. Interestingly enough, we also have the lowest vitamin D levels within the United States. We also have the worst health among all other ethnic groups within the United States. Similar to a plant requiring sun for photosynthesis, we require sun for the production of vitamin D. Likewise, chlorophyll, which is found in plants, is biochemically similar to human hemoglobin, the main difference only being magnesium at the center of chlorophyll and iron at the center of hemoglobin. We can safely say that chlorophyll is the blood of a plant. With all that being said, the same way a plant cannot grow well without exposure to the sun is the same way that we cannot function properly without the sun. Diet is not a major contributor of vitamin D. 95% of vitamin D is obtained from sun exposure. Could the lack of sunlight be responsible for our poor health? The answer is yes. Most people only know the importance of vitamin D in relation to bone health. Vitamin D has implications far beyond bone health, which we will elaborate on shortly. Vitamin D obtained via diet does not supply us with enough vitamin D. In the best case, diet only supplies about 20% of the necessary vitamin D. Here we see a breakdown of how our bodies obtain vitamin D from the sun. Research has shown that vitamin D deficiency may play a role in viral respiratory disease, cancer, osteoporosis, heart disease, multiple sclerosis, diabetes, and hypertension.
The studies just keep coming, the evidence mounting. Low levels of vitamin D are now linked to so many illnesses, from breast, colon, and prostate cancers, type 1 diabetes and asthma, to multiple sclerosis and heart disease.
I even think of vitamin D as the fountain of youth, if you will, in that it allows us to age well.
At least that's the hope. And nowhere is the evidence more compelling than here in the laboratory.
So all the work here is on vitamin D?
Yes, we've got
Professor Joellen Welsh has spent the last 25 years studying the powerful effect of vitamin D on cells.
These are human breast cancer cells growing in the flask.
Taken from a woman who had breast cancer?
Yes.
Now watch what happens when you add a potent form of vitamin D. Within just 4 days, half those cancer cells are dead.
It looks like the cancer cells have basically shriveled up and died.
The longer they're treated with vitamin D, the more of an effect we see. What happens is that vitamin D enters the cells and it triggers this cell death process. It's similar to what we see when we treat cells with tamoxifen.
A drug used to treat breast cancer?
Yes.
That's amazing.
It is amazing. It's a very dramatic effect.
That was just the beginning. Researchers here then took human breast cancer cells and injected them into mice. Tumors quickly began to grow, but when the mice were treated with vitamin D, the tumors began to shrink. Look, this one was reduced to half its size. The one here disappeared entirely. Similar results have been seen on colon and prostate tumors in mice. The real test, however, remains. Will vitamin D work this way in people? Other lab work is revealing how vitamin D can actually improve the way cells function in the heart and in blood vessels.
And the number one killer is vascular disease, and vitamin D makes our arteries more healthy, basically, allows them to age well.
Preliminary, tantalizing research on a common nutrient with so much potential.
Vitamin D deficiency negatively impacts every organ system. Also, it accelerates the worsening of disease. Vitamin D plays a key role in the immune system. Lack of sunlight and vitamin D deficiency can even contribute to depression. Those with deficient levels of vitamin D are more susceptible to infections. Certain medications such as Dilantin, phenobarbital, rifampin, and certain HIV drugs can lower vitamin D levels. Symptoms can vary from being none to non-specific complaints such as fatigue, muscle aches, and weakness. Being deficient will increase your risk of both upper and lower respiratory infections. In these times where we are dealing with COVID-19, also known as the coronavirus, can we afford to be deficient in vitamin D? The answer is no. Typically, respiratory infections mostly occur in winter months. During the winter, the average person has minimal sun exposure. Could there be a relationship between low vitamin D levels and susceptibility to infections such as influenza? Most likely. There is evidence that links vitamin D deficiency to human fertility. Low vitamin D levels can also lead to infertility. Vitamin D receptors are also found in various organs dealing with reproduction. There is also a link between vitamin D deficiency and polycystic ovary syndrome, also known as PCOS. There are links that vitamin D deficiency may also play a role in Alzheimer's disease and stroke. Levels of vitamin D can be assessed via simple blood work. Here we see toxic, excessive, ideal, and deficient levels. Sun exposure, often 20 to 30 minutes daily, can help boost vitamin D levels naturally. Healthcare practitioners may prescribe 5,000 international units of vitamin D3 with 90 micrograms of K2. So with all that being said, we know that we are the sickest people on the face of the planet. Due to colonialization and slavery, we have been taken out of our homelands, which provided the perfect environment for us, which included ample amounts of sunlight. Today, even those of us which live in hot climates have a difficult time getting sufficient amounts of sun exposure due to our hectic lifestyles. Vitamin D deficiency is closely linked to the poor condition of our health, so get some sunlight, it's free.